There are about 68 million Americans who are enrolled in Medicare, and roughly about 35 million of these are on Medicare Advantage Plans. Those are also known as Part C. Now, these plans can be appealing to people because most of them a $0 premium on top of what you pay for Medicare each month. And some of them have some perks as well. But what people don't realize is these plans are pay-as-you-go plans. And you could end up having to pay thousands of dollars out of pocket, anywhere close from $5,000 up to $10,000, depending on which plan you're on. Now, today I want to tell you about a plan that not a lot of people are talking about that can help save you thousands on these out-of-pocket costs if you're one of the 35 million Americans who have an Advantage plan. So let's look at some staggering and really concerning numbers when it comes to medical debt in the United States. So 100 million Americans report that they have medical debt. And this amount together totals $220 billion in medical debt in the U.S. Not million, but billion. So starting in 2025, there were 15 million people who had medical debt and on their credit report. So they have been sent to collections for medical debt. Now, when we talk about seniors, the average senior reports that they have $2,000 or less that they would be able to spend if they had a medical emergency. Now, we're going to kind of get into these plans, but that would not even cover the lowest max out of pocket on an Advantage plan. So that's why I want to talk today about a small side policy that you can get that can help you cover this so you don't end up in collections or with this medical debt. All right, so before we talk more about how you can accrue thousands and thousands of dollars in bills with an Advantage plan, let's first do a quick review of the 3 different ways that someone can use their Medicare benefits. So the first option, and really this is an option we don't recommend, and I'll tell you why here, but that is to have original Medicare Part A and Part B only. So let's look at the cost with that. Well, for 99% of you, Part A is going to be $0 premium, okay? So A is going to be $0 premium because you've been working and paying into the system for 40 quarters or 10 years, or you're borrowing that 10 years or 40 quarters from a spouse, okay? So Part A, $0. Part B, we know next year, the premium is going to be $202.90. So $202.90 per month to have original Medicare A and B. Now, why is it not such a great idea to just have original Medicare? You think, well, hey, isn't Medicare enough? Well, there are 6 different financial gaps in original Medicare, okay? So here's the deal. If you don't have either a supplemental plan or an Advantage plan to help fill those gaps, you are going to be responsible for those. And really the most concerning one is that Medicare is only going to cover 80% of things except for preventative care. And then that means you're going to have to pay 20%. Okay? And there is no cap on this. So if something major happens to you, cancer, heart attack, you have to have open heart surgery, you're in the hospital, and you end up with a $500,000 medical bill, Medicare would only pay 80% of that, and you would be on the hook for 20%. There's no cap, and that can really leave you at a high financial risk. So really, that's the last option we always recommend. Don't be just on Medicare A and B alone, okay? So that's your first option. Now let's talk about the second option, which we have, you're enrolled in Medicare A and B, and you also have a supplemental plan or a Medigap plan, like a Plan G or a Plan N. And then with that, you would also have to add a Part D plan. So this is a separate Part D plan that's going to get you prescription drug coverage because Medicare alone with the supplemental plan does not give you any coverage for those self-administered medications, right? So for the medications you self-administer and pick up at the pharmacy, you need a Part D drug plan. So let's kind of look at the cost associated with this. So we know that A and B, right? A is usually 0. B is going to be that $202.90 a month, okay? So you have to have A and B to get the Medigap or the supplemental plan. Well, when you get that Plan G or that Plan N, it really depends on what state you're in. But I'd say a Plan N can start around $90 a month. The G plans, those on average are probably $150 to $170 in most areas, but we see them as high as $200 or more in some areas. So let's just say roughly like $170 for a supplemental plan, okay? So already, if we just add, let's say even $150 to that $202, we're already upwards of $350 a month. And then on top of that, you have to throw in a Part D drug plan. Now, some of you, if you're on generic medications or really no medications at all, maybe you'll get a drug plan that is $0 a month or $10 a month. But a lot of you might be on more brand name and specialty medications. Some of these Part D drug plans cost upwards of $80 or $90 a month. So let's just take the average. I think the average right now across the country is about $35 a month for a Part D drug plan. So with all this added up, depending on what you get, you are pushing close to $400 a month, probably $350 to $400 a month if you want to go this second route called where you have original Medicare A and B with a supplemental and Part D. Now, even though I say that's got a price tag to it, right? It's probably going to be anywhere from $300 to $400 per month, depending on what your drug plan costs and where you live. We do love this as an option, right? Because this is very comprehensive coverage. There are benefits to having these supplemental plans. There's no networks. You can go see any doctor that accepts Medicare in the country, so you can travel and go to different states and use your plan. They're lifetime policies, so they can never take these plans away from you because you're getting older or sicker. They're still accepted at the major medical centers like Mayo Clinic, Johns Hopkins, MD Anderson, things like that. So there's a lot of benefits to having these supplemental plans, but the problem is not a lot of people have that kind of money in their budget to get it. So it's kind of a luxury item, right? We kind of say it's kind of the Cadillac of Medicare insurance. If you can afford it, it's fantastic, go for it. But a lot of people don't have that in their budget. So what is an appealing alternative are these Advantage plans. And we saw a 4% increase this past year in people who chose to enroll in an Advantage plan. So roughly, it's a little over half. It's about 56% of people who are on Medicare who have these Advantage plans, because what they see is a $0 price tag for that premium each month. So let's look at the cost all in if you have an Advantage plan. Well, of course, still got to have your Part B, so you're paying $202.90 next year to have Part B, okay? Now, most Advantage plans have a $0 monthly premium, so you don't pay anything extra per month to have the plan, okay? Now, some of them have gone up. We are seeing some Advantage plans that are $20 a month, maybe even $30 a month, but it's rare. Most of them are still a $0 premium, and even $20 or $30 is a lot less than the price tag of a supplemental plan, okay? So this can be appealing to people. Also, the drug coverage, you don't have to get a separate Part D drug plan because it's included in the Advantage plan, okay? So that's appealing. Don't have to pay extra for a Part D plan. Also, these plans come with dental, vision, and hearing benefits, okay? So sometimes up here, if people have a supplemental or Part D plan, they've got to add a dental plan on top of this price tag, okay? So here we have down here Advantage plans, Part C of Medicare is what they call it, because it replaces original A and B, and it looks good. You think, hey, I'm only paying $202.90 for my Part B. I'm paying $0 to have the Advantage plan. I got my drug coverage in there, and I got a little bit of dental and vision benefit as well. So what's the downside? Well, here's the thing. These are pay-as-you-go plans. So even though you pay $0 a month to have the plan, you're going to pay every time you have care. So every time you go to a specialist or to get an x-ray or an MRI or blood work drawn, or you're in the hospital or you ride in an ambulance, every single time you pay until you hit the cap. So let's look a little bit deeper about these expenses that come with Advantage plans. Let's break them down. Hey, if you found this video helpful, do us a favor. Go give us a like. We always appreciate it. And subscribe so you don't miss out on any of those future videos. And leave us a comment. We'd love to hear what you have to say. We love to answer any questions you have. That's what it's here for. So drop us a comment below. Okay, so let's break down some of these costs that you're paying as you go on an Advantage plan. Now keep in mind, a lot of people get these because they think, hey, I'm healthy, I never go to the doctor. But we just don't know what's going to happen with our health. You might be perfectly healthy now, but you may have a major medical event or a cancer diagnosis, or heaven forbid, a heart attack or a stroke. Something happened where you need major medical care, and this is where these things can add up. Okay, so first of all, we're going to have a deductible, right? So not all plans have a deductible, but some do. So the deductible means you have to pay this amount in full before the plan will start paying, okay? So you might have a deductible on your plan. You're definitely going to have copays. So every single time you get care, other than sometimes your primary care doctor, it's a $0 copay. But for other things we talked about, like if you go get an x-ray, or if you need lab work done, or you ride in an ambulance, or you have to go to a specialist or the emergency room, you're going to pay a copay, okay? And these copays vary by plan. If you're on an Advantage plan, you should have something called a summary of benefits, and this is going to break down every single little thing for you and what you'll pay, what your copays are, okay? Now, the big one on this that gets a lot of people is if they're hospitalized. So if you're hospitalized, depending on what kind of Advantage plan you're on, and we're going to go through those in a minute, you could pay anywhere from, I'd say, about $250 a night to about $450 per night. Every night you're in the hospital for the first 4 to 8 nights, okay? And this really depends on which plan you're on. So let's say your plan says, hey, you have to pay $300 a night for the first 7 nights you're in the hospital. That's $2,100, right? So this stuff starts to add up quickly, yet alone the other care you're gonna get in this, right? Maybe you had to ride in the ambulance to the hospital. Maybe you need home health care when you leave the hospital, or you have to go into a rehab facility. Your Advantage plan is probably gonna cover the first 20 days of that, but the average stay is 35 days, right? So you're going to have to pay a copay for those extra days that you're there. So this is what really gets you where these things start adding up, okay? Also, you may have to pay co-insurance for that plan. Now, the good thing is with these Advantage plans, there is a cap in what you'll have to pay, right? And we call this the max out of pocket, a MOOP, the max out of pocket. So this means worst case scenario on your plan, how much would you have to pay? Okay, and because you're going to keep paying all these copays until you hit that max out of pocket for the calendar year. So let's take a look at what those could be with the different kinds of plans, okay? So we pretty much have 3 different styles of Advantage plans. First, we have your HMO. So an HMO is the most restrictive when it comes to networks and what doctors you can see. You pretty much have to see a doctor in network or they're not going to pay at all. So a lot of people haven't been fans really of HMOs because they think, well, I don't have a lot of flexibility and freedom in the doctors I can go see. But I will say they can save you some money if you are a little bit more open to changing doctors or seeing doctors in network. Because the HMO plans, the max out of pocket is going to be anywhere from probably about $3,000 a year to $5,000 a year, okay? Now, that's not a ton, right? It's not $500,000, but keep in mind, we just talked about how a lot of seniors report that they've only got about $2,000 or less in a nest egg that they could pay if they had a medical emergency. So you see, even on our most restrictive Advantage plan, if you have a bad year and max out your plan, you're probably putting out $3,000 to $5,000. HMO POSs, now these are a hybrid of an HMO and a PPO, okay? So you're not stuck totally in network. You can go out of network, but a lot of times you have to get, your care is managed by your primary care provider. You have to get a referral from that primary care provider to go see that specialist, okay? So you can go in and out of network on the HMO POS plans. You have a little bit more flexibility. And I'd say maybe those max out of pockets are a little bit more. I've seen them anywhere from about $3,000 upwards to $6,500 depending on the plan. Okay. And then we get into the PPOs, which have been popular because a lot of people like the freedom and flexibility of seeing whatever doctor they want. Now, still, there's in-network on a PPO and there's out-of-network on a PPO. This means you can go to an out-of-network provider, but you're going to pay more. So all those copays we talked about, if you're going in-network to a specialist, maybe you're paying $30, but if you're going out-of-network to a specialist, you're probably paying $50, okay? And this is where we see the higher max out of pocket. These are usually $5,000 upwards of $10,000, okay? And now we're getting into a lot more higher numbers here. Like if you have a PPO and you're in the hospital and you max out your plan, $10,000 is a lot more than most seniors have to pay out for a medical bill, okay? And this is going to end you up in that pool of people who have the $22 billion in medical debt. So again, just to drive this point home and really to set up the need for this plan that I'm going to tell you about, it is reported that the average Medicare beneficiary, the median income for them is about $75,000 to $80,000 a year. But in certain enrollment studies, it's been said that 40% of people who have Advantage plans actually have an income of $25,000 or less per year. This is a tight budget, and it does not leave a lot of room to pay medical bills. And 20% of people on Medicare have reported that they have problems paying their medical bills. All right, so we know the problem, but what's the solution? And really, we're not anti-Advantage plans. People call us every day, and we really educate them on how these plans work, and we help them choose what's going to be best for them. Now, we say supplemental plans are great because they're going to be very comprehensive coverage, but they're not going to be great for you if you can't afford what it costs to have a supplemental plan each month. So a lot of people just have to have Advantage plans. That's the way it is. That's what fits in their budget. So we write Advantage plans every day for people. But here's one thing we always recommend, and that is a side policy called a Copay protection plan. These are also known as hospital indemnity plans, okay? Now, what are they? So that's a separate side policy. It's a smaller policy that you can get. And I would say they start at around $15 to $20 per month. So I've seen them start as low as $15 to $20 per month. And these are offered by private carriers, okay? So maybe you get it through Cigna or Aetna or GTL, right? There's a lot of different companies that offer these hospital indemnity copay protection plans. So what is it? It's a customized plan that we really can match up with your Advantage plan. And what it's going to do is if you end up hospitalized or having to, get a cancer diagnosis or take an ambulance ride, it's going to literally protect you from these copays, and it's going to pay those copays for you. It could pay out thousands of dollars that would keep that money in your pocket just by paying the monthly premium by having one of these plans. Okay, so let's break down kind of what these plans cover. So it's really nice because they're customized. So you don't need to pay more for coverage that you just don't need. So a lot of the things we'll look at, the first main one is hospitalization. So we talked about on your Advantage plans, if you are admitted to the hospital, you're probably gonna have to pay $250 to $450 per night, up to probably 8 nights, okay? So what we will do is if you talk to us, one of our guides, we'll look at your Advantage plan you're on, and we'll literally match up your protection with this copay protection plan to what you need. So if your plan only says you have to pay $300 for the first 5 nights, that's where we'll set the coverage, okay? So that'll help determine what's your monthly premium going to be for this plan. And again, it's pretty low. Like I said, they start around $15, $20 a month. Now, there's some riders that you can add onto this, so some extra riders. So you can add a rider for an ambulance ride. Again, your plan, it could be $200, $300 if you have to ride in an ambulance. So we have a rider where we can add that. There's a cancer rider, and this actually could pay out a lump sum amount, or maybe it would cover some of those copays if you have cancer treatment, okay? And then the last one we see a lot is a skilled nursing facility rider. So again, we talked about what if you're in the hospital, you have a knee surgery or a hip surgery, and you just can't go home. They want to send you to a skilled nursing facility. Again, the average stay is about 35 days, and they're only going to probably cover the first 20 days, okay? So that leaves you 15 days of paying that copay. So we can also add a skilled nursing facility rider. So these are kind of nice because we can customize them to what you need and what you want, okay? Now let's talk about getting approved for these. So with the first 6 months when you enroll for Medicare, you're automatically guaranteed that you can get one of these copay protection plans. Also, we work with a lot of companies that have like guaranteed issued up to a certain age. I think one is 74 years old. I think I've even seen as high as 79 years old, where you're guaranteed through that company to be able to get this plan without having any medical questions or going through medical underwriting, okay? So again, we don't think Advantage plans are bad. That's not what we're saying. But we do think that a lot of people could get in trouble from the data that's out there. Okay. You sign up for a $0 Advantage plan. You think it's going to save you money. But all of a sudden, boom, you're in the hospital for a week. You're going to a skilled nursing facility. You take an ambulance ride there, and you're reaching that max out of pocket of $4, $5, $6,000 that you just don't have the money to cover. Now, all of a sudden, you're in collections, you're getting those medical bills, and it happens with a lot of people. So how can we protect that? Again, these copay protection plans, a lot of people don't know about them. They're pretty easy to get. We can get you a quote in a few minutes. So if you have an Advantage plan right now and you don't have this extra coverage, give us a call. We're always happy to give you quotes on that. Takes a few minutes, and it might help save you thousands with that Advantage plan. Now, if you didn't even know there were all these different kinds of Advantage plans and you need help finding the best Advantage plan for you, check out this video I just made on comparing the best and the worst Advantage plans.